Hello and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blaiklock, and my guests today are Sandy Blair, who is the registered nurse and infection preventionist with Heartland Memorial Health, and Dr. John Godfrey, our Chief Medical Officer at Heartland Memorial Health. Thank you for being here today.
Good morning.
Thank you.
And our topic of conversation actually is infection control and the importance of your role in hand washing. So let's start. We're a hospital, we're a healthcare organization. Why do we feel that hand washing is so important, Dr. Godfrey?
It's the single most important thing that we can do to reduce the spread of infection from one patient to another as employees, nurses, doctors, families move from one room to another in the hospital. Think of just the common things that we all learned as kids. You know, wash your hands when they're dirty. In a hospital setting, there's so many bacteria just naturally. It's really the best thing we can do to prevent each of us from taking those germs from one room to another.
And generally, when somebody is coming to the hospital or a healthcare facility, I guess we should say kind of broad because we are a system, they usually aren't feeling well anyway, and so why reinfect with something else as far as another type of an infection? So tell us a little bit about the chain, Sandy.
Well, with a chain of infection, you start, of course, with a bacteria or an organism or bug, if you will. And that organism has to have a place to live or a reservoir, and that is within our bodies. It also has to have a method of escape, and that is very easily done by just simply talking, sneezing, coughing, laughing, singing. Those are very easy modes of exit for the bacteria to get out of your body. And then it will, as it exits, it will land on a surface. It can also land on our hands, or if we cover our cough or our mouth or touch our face with our hands when those organisms are escaping, then we have them on our hands. Whatever we touch thereafter, we're transferring those organisms to different surfaces. And then when someone touches the same surface behind us, they now have that organism on their hands. So it's just that easy to spread a bacteria or a germ from one person to another.
Well, I'm going to shift, Sandy, because I also heard you say cover and when you sneeze, and that's changed over the years.
Yes.
Because we are learning, and the younger children are learning now to actually cover their cough and their sneeze in a different way. Tell us a little bit about that too.
What the preferable method is for that now is the bend of your arm or in your elbow. And that way you're not coughing or sneezing into your hands where we'll touch so many surfaces. So when we do that, it's still confined and we're not spreading it everywhere.
And I think people are amazed that a sneeze just doesn't go this far. It actually has quite a range, does it not?
Yes, it does.
So
Absolutely.
that's why it's important to use the bend of your arm. So yes. I appreciate you sharing that with us because that's very important. It's hard to break old habits, but those are important things so we're not spreading the germs on our hands. Yes. So let's talk a little bit about why we need to make sure we're washing our hands and you know, what we need to use when we wash our hands.
Soap and water, plain soap and water is the very best product to clean your hands well. It just matters that you're washing for at least 15 seconds and that if you kind of sing the happy birthday song while you're washing your hands, then you've washed long enough. But you also want to go above your wrist, about an inch above your wrist, and just the friction causes the bacteria to fall off of your hands and into the sink. And you also can do this type of thing to get underneath your fingernails to make sure that we're washing everything that we need to wash.
And I wondered about that too, Sandy, because I think sometimes we see people just rub the insides of their hands and they forget to actually get the outsides,
Right.
and you mentioned up into the wrist, so that's very important. What about when we dry our hands and we have that paper towel and we want to maybe exit the room or the bathroom? Is there a specific way maybe even to do that? What should we do to ensure that, I guess, not breaking that chain of infection?
And hand washing is the easiest way to break that chain of infection. It's documented as an evidence-based that that's the best thing that we can do to stop the spread of infection. So that's a great point as far as getting out of a bathroom safely, as far as once your hands are clean, how do you get out without recontaminating them? Because door handles, elevator buttons, those type of things are very high touch areas, and they're the most contaminated areas in any public facility. And so once you have washed your hands and you get a paper towel, once you have dried your hands, you want to hold on to that paper towel and turn your faucet handle off with that. And also use that paper towel, keep it in your hand, and use that to open the door handle in order to be able to exit the bathroom and still have clean hands.
Excellent, excellent idea. And what should we do, maybe, Dr. Godfrey, if we don't see somebody wash their hands? Is there something that we could maybe invite people to do?
Yeah, a phrase that's becoming more popular is, have you seen Dr. Hands lately? Just a polite way to remind them to, of the importance of washing your hands. Kind of maybe bringing them aside and just saying, hey, this is really important to help prevent illness affecting you as well as you spreading it to someone else.
So we encourage individuals really to speak up and say, have you washed your
Correct.
hands, and
Yeah.
invite them to do that, because we're all ensuring the safety and the well-being of each other and doing that too. What about alcohol, the alcohol rubs? Are those as effective as washing your hands too if you don't have soap and water?
They are as effective as washing your hands with soap and water, with the exception of if your hands are visibly soiled. The preferable method for that is still soap and water. We have certain organisms within the hospital setting that we deal with that soap and water is the preferred method to wash your hands, and one of those is Clostridium difficile, or C. diff. That is a very tough bug, and it's an enveloped virus that is sort of like concrete. The only thing that will kill that spore form is bleach. So we can't wash our hands with bleach, of course. So we want to wash our hands over the sink whenever we're dealing with that particular organism, so that the spores from that organism will fall into the sink and not on the floor, as they might if you're using hand foam and walking down the hall.
So, I mean, the patient's family and or people that would be come in contact would be aware of knowing that that individual might have C. diff, so that they would take extra precautions and whatever they needed to do, correct?
Yes,
All
yes.
right. What about personal protective equipment, Dr. Godfrey? We hear something called PPE. What does that actually stand for?
It stands for personal protective equipment in the hospital, and when you're in a hospital setting, you'll see various rooms where patients are in what we call isolation, and it's not as much for the patient's benefit as much as for all the other, patients in the hospital, because what we're trying to do is to keep the bacteria isolated in that one room before it can be cleaned before the next patient comes in. And so we use personal protective equipment, or PPE, so that we'll put on gloves, we'll put on a gown, sometimes even a mask, to protect any bacteria from maybe inoculating our nose, and not really to keep ourselves from infecting that patient, but rather to not transmit the bacteria as we exit the room and then go to the next room. As we take off that personal protective equipment, we still have to wash our hands with soap and water or the alcohol foam. Before we put on that personal protective equipment, it's important that we do the same, because each time you touch that with your contaminated hands, you're pretty much infecting that PPE equipment, and so it's real important to hand wash before and after you put on that equipment.
Cindy, actually working in that department, you all have guidelines for the individuals that might have to be in an isolation type of a room, correct?
Yes.
And then the family members that might be coming to visit would be asked to put that equipment on too?
Oh yes, absolutely. That is very, very important. And sometimes it's very difficult for visitors to understand the importance of wearing the personal protective equipment as well. They will say, well, I'm in the same home with this person. So the reason that that's still important is because, they may have the organism too, but it's sort of sleeping within their body, if you will, because they're healthy right now. So it's not causing an infectious process for that family member, but it is for the patient. The patient is sick, so that organism is also causing illness to that patient. So it is just imperative that everyone wear the personal protective equipment in order to not continue to spread it. You don't have to be actually infectious. Even if you carry the organism, you can still spread it. So that's why it's so important for everyone to wear their gowns and gloves and masks, depending on what's required for that particular organism, and to wash their hands as they enter the room so that you're not causing more infection to your loved one, and also as you exit the room.
Now, you may be asked, and I think we should probably talk about this too, that if you're coming to a healthcare facility, hospital, and or one of the other facilities within our system, maybe even to put on a mask depending upon what symptoms you may be exhibiting too, correct? And that's just for the safety of not knowing what actually is going on with that individual and or the other people that might be exposed. Is that correct?
Correct, because many illnesses are transmitted by what we call the droplet or aerosolized route, and as you cough or sneeze, as we'd mentioned earlier, it's not just in a small confined area, it actually is a widespread area that you're transmitting that to. And so if you come into a hospital setting, you think you might have some respiratory condition, whether it's the sniffles or nasal congestion or a bad cough, it'd be best to cover that with a mask to try and keep it confined, and so as not to transmit that illness to anybody that you might come in contact with as you move through the halls or in the patient rooms or in the cafeteria or whatnot.
Now, Dr. Godfrey, as a physician, you probably have prescribed an antibiotic because a lot of individuals need to take that in order to get better. Tell us why it's important when you have that antibiotic to finish that whole course of antibiotics, even though I might be feeling better after the third day.
Yeah. Well, when we think of prescribing antibiotics, there's usually a duration, and if you think of the number of bacteria that you're trying to kill off with that antibiotic, there's a certain volume, and the antibiotic is going to knock down some of those bacteria, but at the same time, the ones that are still remaining are continuing to reproduce, to divide, and to grow like all living things do. And so it takes time to knock that down to a certain level that your body's immune system can fight it off on its own. And so each day you knock down a little bit more. You usually will start feeling better with an antibiotic within about 3 to 5 days. But that's just to the point that the bacteria is getting beat by the antibiotic. So you need to continue and complete the whole course to knock it down as far as possible to allow your body to fully recover.
And that being said, Sandy, I think we're seeing some things that are resistant. Is that correct, to antibiotics due to the fact that people have not necessarily finished sometimes their antibiotics?
Oh yes. When you don't finish your full course, that's just one way that we can cause a mutation of organisms. That is one way and one reason why we see new organisms come into play periodically. As an example, only just a very few years ago, well actually within the last 4 years, there is a new organism that's called CRE, and it's a very bold organism. If you encounter even one case of that in a hospital, it's considered an outbreak. And unfortunately, pharmaceuticals are not developing antibiotics as rapidly as we need them to. So with these new organisms on the horizon and the ones that are here, sometimes it's very hard to find something to treat. And we're just as different on the inside as individuals as we are on the outside. So the both of us could end up with the same organism growing inside us, but the antibiotics will work very differently for you than they will for me. So it's very important that we continue to finish our antibiotics as they're prescribed, to clean our hands properly, and to keep these organisms as confined as possible.
Well, and on that note too, we should never share antibiotics. If it's prescribed for you, you need to make sure you're the one that's actually taking it, not saving it and giving it to someone else when they start to maybe have some of the same symptoms. So that is your antibiotic, you take it. And not everybody always gets an antibiotic. I think we need to say that too. Sometimes individuals feel that they need that antibiotic to feel better, and there's a difference between a virus and a bacteria. Dr. Godfrey,
Correct.
go ahead and speak to
Most
that.
viral illnesses will sort of smolder along for several days, really not worsening, but not improving either. It just really makes you feel run down, kind of crummy, pretty rotten. But most people are still fairly functional with a viral illness. The ones that I always would get concerned about taking care of people are each day someone would feel worse and worse and worse. Usually with most respiratory conditions, coughs, colds, sinusitis, bronchitis, you're going to start to feel better in 3 to 5 days. The ones that I would worry about are the days that you get successively worse, or if someone has an underlying respiratory condition such as asthma or COPD, or if they have something that would compromise their immune system where their risk of getting seriously ill goes up exponentially. Those conditions include things like diabetes, bad congestive heart failure or an underlying lung condition, someone with HIV, or if they're on medications that would suppress their immune system, such as steroids like prednisone, or if they have had a transplant and they're on immunosuppressants. There's a lot of other medications that are used today for other conditions such as inflammatory bowel disease like Crohn's or ulcerative colitis, skin conditions like psoriasis, where these agents are actually suppressing the immune system, and we have to be careful with those medications. So people on those types of medicines, we would be more likely to prescribe an antibiotic just because of the risk and benefit ratio. But if someone is otherwise healthy, it's really the best practice to not prescribe an antibiotic up front, give it a few days, see how someone is responding, and then consider that antibiotic at that point.
So to recap, we've really been talking about your important role and how you can help us with and help yourself prevent the chain reaction, I guess, with the infection and break that by making sure that you're a good hand washer, obviously, and finishing your antibiotics. So let's go back to the hand washing component because we use our hands a lot and it's important that we know we need to use soap and water. Is there something with that antibacterial soap that we hear out there, Dr. Godfrey, is that the soap that we want to use?
Probably
versus a
not.
regular?
Probably
Okay.
not. I think the mass media and big companies publicize that enough, mainly to make a profit. But there is really no proven benefit between an antibacterial soap and regular soap. I always think of plain ivory soap that's inexpensive. That's just as effective because it gets to how soap disrupts the bacterial cell walls. There is a difference in soap. The antibacterial soaps tend to leave a residue that sticks around. In a hospital setting, there are times when we would probably want that residue to stick around to fight the bacteria, but in a home setting it's probably not as important. And there's some research recently that suggests that those residue-producing soaps are actually killing off good bacteria that we all need on our skin and promoting resistant organisms because of that. And so there's some thought now that the antibacterial soaps might actually be contributing to more harm than good.
And then the gels, the little foams and the gels that we use in between are okay once in a while, but it sounds like we really need to go back to the sink and wash our hands and make sure we're using soap and water. Is that correct?
Soap and water is the best. And typically the gels or alcohol foams, they're primarily just alcohol. And that is a disinfectant, so it's really not necessarily of antibacterial properties. It would not be, I don't feel, as harmful as antibacterial soaps, but still soap and water is your best mode of cleaning your hands.
And I think I read somewhere 60% alcohol. We need to at least make sure if we're using something like that, it has a substantial amount of that alcohol in there. Is that correct too? Okay. Anything else you'd like to share with our viewers as far as prevention? I know we've really stressed the importance of hand washing throughout the year. I think we have to throw that out there. I think, we hear heightened campaigning around, cold and flu season, but it's always important to wash your hands.
The main thing that I would like to express to everyone is that it's not just for for the patients or for the family members, the visitors, this message is not just for them. We also want you to be aware that all healthcare workers, as they enter your patient room, we want you to be cognizant that we're all supposed to wash our hands as we enter your room and exit. We want you to feel comfortable that if you don't see that, to please speak up. Feel free to call me. Any of the staff know how to get a hold of me. We would be more than happy to address that. If you ever have any questions regarding your care as far as infection goes, we are more than happy to come talk to you and talk about the organisms that may be going on that you might not fully understand, or the processes and hand washing and the use of gowns and gloves and masks, and we're happy to help in any way possible.
Sounds good. Dr. Godfrey.
And I would agree. I think one of the most important things for people coming into the hospital, both families and patients, is if you see something that just doesn't look quite right, say something. Don't be afraid to speak up. Don't be afraid to ask any employee at the hospital, any physician, any nurse. I think from my perspective, I got the sense that patients and families are almost afraid to ask questions for fear of looking unintelligent, looking ignorant, but there is no dumb question. And really the best thing, if you sense something is wrong, it usually is. And all the people at the hospital, physicians on down, are human. Mistakes can happen. It's not intentional, but we want people to hold us accountable and keep us honest. And I think hand washing is one of the most basic things that we can be doing in a health organization. And so we want the public to be looking out for us and get our backs for us.
So we encourage you to speak up. We encourage you to wash your hands, ask others to wash their hands. And for more information, you can go to our website at www.hmh.net. And we hope you tune in next month for another important edition of Health in the Heartland.